Hello, I'm Hadley McIntosh Marchek from the American Chemical Society. Welcome to this media briefing for ACS Fall 2021. We're joined today by Dr. Bikram Subedi from Murray State University. His team flushed out drug use during the early COVID-19 pandemic. Dr. Subedi?
Thank you. Thank you, Hadley, and the entire ACS newsroom for providing this platform to share our research findings with a broad chemistry audience. I greatly appreciate it. We have monitored the trend in the use of illicit drugs and the prescription drugs of potential abuse through wastewater analysis in two communities of Kentucky and Tennessee during 4 early months of COVID-19 pandemic. As we hypothesized, we found a significantly different use profile of different drugs during COVID lockdowns. We found a steadily increase in the use of hydrocodone. That was about 72% increase. Hydrocodone is an opioid and the most prescribed controlled substance in the state of Kentucky. Hydrocodone is in fact was accessible through the teleprescription during COVID lockdowns. Whereas the illicit psychostimulants such as cocaine and methamphetamine were significantly decreased, about 40% and 16% respectively, and that potentially due to the disruption in international and domestic transportations or travels. However, the use of such illicit drugs was trending up as the lockdown restrictions were easing out. Overall, we were able to determine the trend in substance use during COVID-19 lockdowns in 2 US communities using wastewater analysis. And our findings are well aligned with the increased opioid overdose hospital ER visits, as well as the decreased trafficking and possession citations of illicit psychostimulants reported by the city or the state law enforcement.
Thank you, Dr. Subedi. I'd like to ask you a few questions about your work. Are treatment plants able to remove most drugs or remove drugs from wastewater?
That's a great question, Harley. That was not one of our goal of this project. For the wastewater-based epidemiology, we typically collect wastewater from the wastewater treatment plant before any wastewater treatments and analyze that for the drug residues and back calculate how much drug being consumed in community. However, we have published one paper on science of total environment about how much these drugs being removed by the wastewater treatment strategy, existing wastewater treatment strategy. And we found that some of those drugs being efficiently removed, but many of those drugs were almost discharged from the wastewater as they receive. And some of those drugs were even at the higher level than they received because of the transformation of some of the drug residues in the wastewater treatment process. And more importantly, the wastewater facilities we have now were not designed to remove this type of polar chemical drugs through the wastewater treatment plant.
Okay. SARS-CoV-2 has been detected in sewage. Did you test your samples for this virus? And were there any special precautions that you had to take with dealing with these untreated raw wastewater samples?
Great, thank you. Our technique we call wastewater-based epidemiology, wastewater analysis to predict or to estimate what's going on in community has been really highlighted after the COVID pandemic. I totally agree. And me and the researchers around the world actually were analyzing the wastewater from different communities to look at the SARS-CoV-2 viral copies and trying to correlate it with the COVID cases in the communities reported by the county or the city health department. We have done that for the couple of months in one of these community. We have we did that study in one of this community, and we were fortunate to have that highly correlation between our wastewater estimation to the health department reported COVID cases.
Okay. And were there any special precautions you had to take with your sampling?
Um, yes. Well, first of all, we didn't know much about whether the people collecting wastewater will be impacted with all this COVID. So we had to have some sort of precaution. Uh, we use N95 mask during the collection with the wastewater collection, and we handled the wastewater during the COVID time more differently than that's what we typically do in the lab, using proper PPE, including N95 mask. All the samples we process inside the fume hood, negative pressure. That's what we did.
Did you test any of your samples for fentanyl, which is associated with a lot of the drug overdoses that we've heard about? And if so, did you see any differences from before the pandemic?
Yes, we analyzed fentanyl. Fentanyl was one of our target drug in this project. We detected fentanyl. Unfortunately, fentanyl being consumed in communities at a very small dose is relatively challenging, more challenging to determine such drugs in wastewater. However, we consistently detected fentanyl in these two communities during COVID pandemic. What was the second part of the question? Sorry.
Were there any differences from before the pandemic? But it sounds like they're fairly low concentrations to begin with.
Yes, their levels were fairly low, and unfortunately, we didn't have the background samples. I mean, the wastewater, we have not been collected samples before the COVID, so we could not make that comparison. But during this 4 month of COVID pandemic, there was a consistently lower level of fentanyls we had been detected on those communities.
Okay. And I know one of your other team members also examined wastewater samples for isoprostanes. What are isoprostanes and how can they help tell about community level anxiety?
That's a great question. Yes, as we have described in this paper, due to all these COVID lockdowns and stay at home orders and quarantines, definitely there was a community anxiety, elevated level of community anxiety. And we thought whether we could monitor some sort of oxidative stress biomarkers in wastewater to understand really about the community anxiety, the level of community anxiety. And we chose 4 major oxidative stress hormones, or we call isoprostanes. The class of those biomarkers, we call it isoprostanes, and we analyzed those in these two community, and we significantly we found that the level of those biomarkers was significantly elevated from March to July 2020 during that early stage of COVID pandemic.
And were those related in any way to some of these anxiety related or antidepressant medications that you were looking for?
We did not find a strong correlation between the stress hormone, the isoproteins levels, and the antidepressant consumption. However, both were elevated during the early 4 months of COVID pandemic.
How can the method that you used, which is called wastewater epidemiology, complement some other methods for monitoring drug use or community level anxiety?
That's a great question. The wastewater-based epidemiology method approach of determining drug prevalence in community is a comprehensive approach. It tells you the total amount of drugs being consumed in that particular community at that certain period of time. On the other hand, the conventional approach of determining drug prevalence in communities, such as or which based on the survey questionnaires or the drug seizure, the hospital admissions, that requires the involvement of different stakeholders in the communities. It's more time consuming and even cost intensive. However, the wastewater-based epidemiology is almost a near real-time approach of determining drug use in community, and it's comprehensive. For an example, during this COVID pandemic, one of the syringe exchange, one of the community in Kentucky who has been, which has been employing this syringe exchange program for the past couple of years, they experienced the spike in the number of syringes being received by the clients during COVID pandemic, especially during those early period of COVID pandemic. And we also analyzed the wastewater samples at that time in that community, and we found very high level or this elevated level of drug consumption in that community. So utilizing our data, the community health department, they can really understand the profile of the drug consumption. They can look at the trend of drug consumption, as well as they can also determine the hotspots of drug consumption.
And so you mentioned that it's a relatively fast approach. How long does it take to go from collection through analysis then?
That's a great question. Well, it can be as short as few hours, but typically our method, we rely on 24-hour composite wastewater sample collection that provides us more representative sample of wastewater. And we bring that to lab and do some sample preparations that takes about a couple of hours, 2-3 hours of sample preparation, and basically 30 minutes of sample analysis. So overall, within 5 or 6 hours, we'll get all the data ready for the samples, and that can tell us how much drugs was consumed, how much drug were consumed yesterday, even today. So that's why we call it near real-time approach of determining drug prevalence in community.
So you're presenting on the early COVID pandemic and drug trends during that period of time. Have you continued doing this sampling beyond, and have you continued monitoring for any changes since then?
We have been monitoring. We have been monitoring the drugs, the varieties of different drugs in several communities in Kentucky. Even after that, some of the drugs kind of changed their trend. Some of the drugs still consistently trending up. We have not been able to report those data yet, but we will do that in near future. And yes, to answer your questions, yes, we are monitoring those drugs in several communities in Kentucky.
So then in closing, what's the key message that you want people to take away from our talk today?
Well, wastewater-based analysis is an evidence-based comprehensive approach of determining the trend in drug use and several other substances of interest. We were able to monitor the trend in use of several illicit drugs and prescribed drugs of potential abuse during early 4 months of COVID-19 lockdowns. We found steadily increase in hydrocodone, and the most prescribed controlled substance in Kentucky, and that potentially due to the fact that the people had convenient access to opioids through the teleprescription approved refills. And on the other hand, illicit drugs such as cocaine and methamphetamine was significantly decreased at that time, potentially due to the global disruption in supply and distribution of drugs and a consequent increase in the cost of drugs. Overall, the drug availability and the potential adulteration in drug during limited supply of drugs altered the drug use profile. However, the use of illicit psychostimulant was also trending up as the lockdown restrictions were easing out. And increased use of anxiolytics and antidepressants during COVID-19 pandemic shows the adverse psychological health in the COVID impacted communities.
Thank you. Media briefings for ACS Fall 2021 will be posted throughout the meeting at www.acs.org/ACS Fall 2021 briefings.